Hello there, I'm Saul Saenz, and this is ABC-7 Extra coming to you from Nations Tobin Park, where right in front of me and to the side, COVID-19 testing is underway. And on its way to El Paso is a COVID-19 Pfizer vaccine. Tuesday, the Food and Drug Administration released a positive review of the coronavirus vaccine. The review is a key step to verifying vaccine safety, effectiveness, and side effects. On Thursday, a group of independent experts reviewed the FDA's findings and voted to recommend the vaccine. University Medical Center will get more than 2,900 doses. The hospitals of Providence East Campus will receive 975. The same for the Memorial Campus. Del Sol and Las Palmas Medical Center will both get 975 doses. But how much do we know about the vaccine, side effects, who will be vaccinated initially, temperatures the vaccine must be stored at, and what happens if the vaccine is not stored properly? Here to talk to us about all this is Dr. Ogachika Alozie, who is with the Governor's Task Force on Infectious Disease Preparedness. Thank you so much for taking time to talk to us.
Thank you, Saul.
And I was pointing out that right behind you, COVID-19 testing is underway right now. Let's start with the vaccine. What do we know about it?
So I think what we know about it is that a lot of people have concerns that this vaccine was rushed. And I mean, Operations Warp Speed and everything else. But really what it's been built on is over 20 years of research funded by the NIH and a host of other organizations. The technology is new, the technology is different, but it's gone through rigorous trials. It's gone through phase 1, 2, and 3. Luckily, Operation Warp Speed allowed it to be produced at the same time. And so when people say they're not ready, it's too fast, I tell them this has been going on for well over 20 years, and the science is sound.
Yeah. When you say the science is sound, do we know about the side effects?
Yeah, so I think the side effect profile, especially in those who have received the second dose, about 50% get headache, over 60% have fatigue, some people have body aches and chills. But this is nothing new for a vaccine, and actually you want that to happen, right? It shows that your body is mounting an immune response. And these are all things that I think are well worth the conversation about, is it this or is it putting yourself at risk for COVID, right? A lot of times when people say, well, what about the people that got Bell's palsy? And I said, if I had the chance or the choice of having Bell's palsy versus being upside down in an ICU, I'll take Bell's palsy personally.
I have to admit, I'm part of that viewing public right now is probably asking, what is Bell's palsy?
Absolutely. So Bell's palsy is a neural disorder of the face. It's usually one-sided. People have a droop in the face. They start to drool, but it's usually transient, and it usually goes away. There's a small percentage that's a little bit longer term, but again, think about the risks of having a loved one in an ICU or the loved one in a hospital where you can't see them versus Bell's palsy. And again, I think the FDA has already said that they don't believe the Bell's palsy piece is a side effect of the vaccine.
Now, you heard me, Dr. Alozie, read off the number of doses that each hospital is going to get. It doesn't sound like a whole lot. Yeah. How effective can it be when we're getting so few?
Yeah, so again, I think you have to remember, we don't have general availability of this vaccine just yet. It's going to come in multiple tiers. There's tier 1, 2, and 3, and within each tier are subdivisions. I think what's massively important up front is getting the most vulnerable vaccinated, right? So that's going to be the nursing homes, the long-term care facilities, the healthcare workers who have been on that front line for the period of this pandemic. You get that done first, and then the government will roll out subsequent tranches of this vaccine.
Tell me about herd community or community immunity. Do we have to reach a certain level of vaccinations in order to achieve that?
So the conversation about herd immunity is really about how many people need to get a disease to reduce the transmission. It doesn't shut the transmission down, but reduce it to a point where we can continue to live in society. That number is usually put anywhere between 60 and 80%. The best estimates for El Paso, in spite of all that we've gone through, is maybe 15 to 25% of El Pasoans have been connected with COVID-19. To really get us to that so-called herd immunity, we're going to need 70+% vaccinated to get us to a point where a year from now, so we're having a conversation potentially inside, back at the studio, and families can start to get back to the celebrations of the holiday spirit that they really want to.
And that, the percentage that you just noted right now, 70%, which is the maximum, right? Yep. Will people still need to be tested, just like we're having testing going on right now behind you? Will people still need to be tested?
Well, I think it's important for people to understand that vaccines on their own are not the solution. I think of it in terms of a Swiss cheese model, right? So first we had physical distancing, then it was masking, then it was hand hygiene. We have testing. The vaccine forms let's call it the seventh layer of that Swiss cheese model. We hope that a year from now, if we can get enough people vaccinated, people can continue to wear masks and condition themselves, that we'll get to a point that we've reduced the transmission enough that we won't need to wear masks.
That's what I was going to ask you about.
Absolutely.
This right here. It is pretty much a face, I guess, a straitjacket for a lot of people.
Understand.
At what point in time, after we receive 70% immunity, at what point in time will people be able to remove the mask and be able to not really observe as much social distancing as we are doing right now?
I mean, I think everybody wants to get to that stage, right? But I think it's important for people to understand that's not in the near term, right? The hope is that a year from now, if we can get the message out to our community that vaccinations are critically important, but continue to stay diligent. Because we get, what do you call, 3,000 in one hospital, 975 in most of the others, vaccines, that's not going to change the dynamics of COVID in our community. We're not going to be able to change those dynamics until the spring and most likely the summer, where we have general availability and everybody's actually getting that vaccine. Let's get to that 70 and 80%, then let's have that conversation. The hope is with enough people vaccinated, we can drop the face straitjacket, right? We can stop having to physical distance. But I think it's too early to have that conversation just yet.
All right, Dr. Lozier, we're going to take a really quick break. This is ABC-7 Extra Sunday Edition. When we come back, we'll talk about the vaccine, a little bit more about the vaccine. Should the vaccine be stored in special refrigerators, or will dry ice do? This is ABC-7 Extra, where news comes first.